Okay, so let's go ahead and get started. Hi, everyone. I'm Gigi Henry. I'm just going to do some little housekeeping before we get started. Couple of things. First, this session is being recorded, so I want to make sure that you guys know that. We've got a PowerPoint that is displayed right now, but I want to make sure that you guys all know that you should only be using the chat feature for questions. So please, no comments in the chat feature. We've done this several times now, and we literally answer hundreds of questions throughout the presentation. We'll do our very best to get real-time answers to you, but we will be producing an FAQ after all of these sessions are done from the questions that you all are asking in the group chat. You'll also be able to access the PowerPoint and the video trainings as well through the portal towards the end of this week or the beginning of next week. Just a reminder that this new platform will not go live until 7/1. You all will receive an email prior to 7/1 with download and login instructions. We will not be sunsetting our Wellcare system. So for our legacy Wellcare agents that are on the phone, this is not a hard cutover to use Ascend on 7/1. We will not be sunsetting those systems until closer to AEP. And when we do sunset the Wellcare enrollment platforms, we'll be sure to let you know in plenty of time. The VBE or HRA processes will continue to remain separate and unchanged for Legacy Centene and Legacy Wellcare. So you will still continue to follow those current processes. One of the things that I want to make sure that you guys all know, and we get a lot of questions about this, so this is very important to hear what I'm saying. Madison's going through all the different features that are within Ascend. There are so many tools that are in here that could make your lives a lot easier when you're doing plan compares and new technologies that are going to assist you through our COVID-19 AEP environment. But it's important to know you do not have to use all of these features. If you simply want to use Ascend to do an electronic enrollment, you can absolutely skip directly to the enrollment part and start data entering that member's information in. So I want you guys to keep that in mind. She's going through all of the great and different features within this tool, but you're not required to use them all. The last thing I want to mention, I know we have a lot of agents on this line that maybe are currently using Ascend through another carrier. You will not need to download a new version of Ascend. If you have used the same email address when being appointed by those two carriers, then you can use one login and one password to get into Ascend. You'll be able to see all the carriers once you log in. If you have used two separate email addresses during your appointing process with those carriers, then you'll have two separate logins. But you will only need to download the app once. If you wish to not have separate logins, what you'll need to do is update your email address with those carriers and then call the Ascend help desk line to get your accounts merged. I think that's it as far as housekeeping items go. Madison's going to go into a great more detail on some of those items that I mentioned. But before we get started, I'm going to pass it over to Britt, and he's just going to highlight a few of the other great features that are going to be available to you. So Britt.
Thank you very much. Again, my name is Britt Travis, the Regional Vice President for Medicare here in the West. And I am just extremely excited about the opportunity to roll this out for us going into the new selling season AEP. As Gigi's already kind of indicated, there's a number of unique features that are part of this Ascend technology, Ascend tool. We at the Legacy Centene side have had an opportunity to be at the ground floor of helping to develop or being a part of the early development of this tool, and it's been an extremely positive relationship and experience. And I think the benefit that we've gained from having this technology has been significant, and I think. We probably look like we can tell the future, because having that put in place with what we're all experiencing in the COVID environment was extremely timely. So again, we're excited about that. Key thing, again, to take away from this is that you now have one platform for all of our plans. So it's kind of a one-stop shop, which would be great. I know not, having those of you who sell Legacy Wellcare or Legacy Centene or Health Net or Allwell, Now you have it all in one place. So that's great. I think they'll go through this in a little more detail here shortly, but obviously the rate feature is now available for all of our legacy Wellcare agents. And it also supports, again, allowing you to do, excuse me, telephonic enrollments. Excuse me. Also, the new quick quote tool is a very similar feature, very similar to DocuSign. And again, so it allows you to send that application out electronically for signature. Again, and currently in our current environment, this is a great benefit, I think, to everybody. So we're excited about that capability being incorporated into the Send tool. In addition, you'll have the integrated PCP search tool that now includes providers who were previously marked as, do not include in the directory. So I think that's going to be a great again additional tool. And so I think those are just a few of the features that we're excited about having added to the Ascend tool. Again, a lot of features, a lot of functionality in this thing that will make your lives easier and hopefully make it a much better experience for your clients as they make that right decision to enroll in one of our Wellcare Centene programs that are out there. So again, thank you very much for joining. We're looking forward to a long and successful relationship with all of you, and anything we do to help, we're looking forward to doing that for you as we move into the AEP season. So thank you very much. Gigi, back to you.
Thanks so much, Britt. So without further ado, Madison, I'll let you take it away and lead us through the training.
Great, thanks, Gigi. Like Gigi mentioned, my name is Madison, and I will be taking you guys through the Ascend user training for Centene and Wellcare. For those of you that are not entirely familiar with Ascend is a secure, encrypted, real-time, cloud-enabled data platform that brings together all the necessary tools you utilize in the field to have meaningful engagements with your prospects. Ascend is a modular system with many functions, and I have a few of them listed here on the screen. We'll go into more depth, not only with these few items, but with quite a few other items as well. We have the electronic scope of appointment, electronic application completion and submission, audio recording capabilities, the ability to play your point of sale video in the mobile application. It replaces the need for paper sales support and marketing documents. And your managers can instantly send you a message from the Ascend Real-Time Manager to your mobile application. We designed Ascend specifically with the insurance industry in mind. It's currently used by over 40,000 agents across the nation. Ascend is available for iOS, specifically iPad, and Windows platforms. Ascend maximizes the field sales and beneficiary interaction and onboarding of your prospective members, and also captures all of that important prospect information that you need to complete an enrollment and allows for immediate action upon new member enrollment. So what will Ascend do for you? It's going to protect your business. Ascend has been proven to drastically reduce the potential for complaints to Medicare by utilizing the recording capability. Ascend will decrease the administrative work. From the mobile application, once you create a lead, all of that lead information will port over automatically to the enrollment application itself. The required data fields cannot be missed as they're indicated with a red dot and an asterisk. Ascend will help you keep the sales that you've worked so hard for. Since the applications are submitted electronically, that means that they're received on the same day, which ultimately means your prospects and beneficiaries will receive their welcome letters a lot quicker. Ascend keeps you connected with your manager while you're in the field and compliant through one simple application, rather than having to go to multiple different applications to look up sources. We'll have all of your sources within the mobile application itself. Ascend will also help you create a clean, smooth, and professional presentation. You won't have to carry around a bunch of different papers which will make it seem more professional. We do have an integration with Salesforce. Salesforce will send updates to Ascend, such as new leads that will get pushed to your mobile application. And this will come over with the lead source as SFDC. Ascend will then take those updates from a meeting you've held with a lead that came from Salesforce and send updates back to Salesforce, so all the updates are housed there as well. Getting familiar with Ascend, there are 3 components. The bulk of this presentation will be focused on the Ascend mobile application, or AMA, and Ascend quote and enrollment, or AQE. We'll touch briefly on the Ascend Real-Time Manager, also known as ARM. The Ascend Real-Time Manager, or ARM, is where all of you will go at one point to download the mobile application. This is also where you can manage your book of business if you aren't doing so within your mobile app. Once you've uploaded recordings from meetings, they will be stored in ARM for your managers to extract or listen to. And they can also extract reporting on Teams as well. AMA is the Ascend mobile application. And this is the app that you will actually download to your device. AMA is where you will conduct and record your sales meetings. And ultimately, it's where you're going to be managing your book of business and tracking your lead and prospect information. Within Ascend mobile application, we'll have AQE, which is where you'll submit your electronic enrollments. AQE is the tool in Ascend that allows you to compare plans side by side to help choose that best plan for your prospect. This is where you'll create your member profile utilizing provider information, formulary information, and pharmacy selection. This is where you will actually complete the online enrollment application and where it will be housed. There are a few things on this slide that show what some top agents have had to say about Ascend, such as using Ascend has made me 20% more productive, and Ascend added to my professional appearance and allowed me to complete my enrollments in a very short period of time as opposed to a paper application. Getting to the Ascend Real-Time Manager, there are a few things to mention here that will be pertinent to you. Once you are ready to download your mobile application, you'll enter the URL that is found on this slide. You will then utilize your email and temporary password that will be provided by your manager. On this screen, you can also click Forgot Password to send a password reset, just in case you forgot your password at any point in time. Once you've entered your email and temporary password, you'll click Login. And we'll be taken to a screen that will look very similar to this. Up in the blue bar, you'll have 3 options, but really you'll just need to focus on the download section, as you'll be able to utilize meetings and leads within your mobile application. From this section, you'll either install for iOS, which is iPad 11 or higher, and you can also install on a Windows device as well. From this screen, you can also access the mobile application user manual. If downloading to an iPad, there are a few additional steps you will need to follow. In order to make sure that your device is capable with or compatible with AMA, you should be using iOS 11 or higher. You'll then need to follow all of these steps to a T to make sure that you will be able to utilize the mobile application. All of these steps will be available within the deck itself, and it will appear on the screen when you download the application on your iPad. Diving into the Ascend mobile application itself, The first screen that you'll see when you open up the app is the login screen. From this screen, you can manually sign in using the same email and password that you did for ARM after you reset your password. You can also have it remember your email address, utilize Touch ID if on an iPad, and you can enter Sandbox mode. We'll get into Sandbox mode towards the end of the presentation. On this screen, you can also reset your password, tap on the help button for information to contact the help desk, and also see the version information of your mobile application down below. Once you've logged in, you'll land on the home page. You'll see your name in two places, in the upper right-hand corner and where it says Welcome Madison. Breaking apart this screen a little bit, this is the main window. The main window will change based on the selection you make using the navigation bar on the left-hand side or the drop-down menu in the upper right-hand corner. The navigation bar is visible from all sections of your mobile application. You will have your home page, leads, where you will manage your book of business, appointments for seminars and home visits, recordings, resources, which are available during applications, and help. In that upper right-hand corner drop-down menu, there are a few differences between iPad and Windows. All of the options that are available on iPad are also available on Windows. However, Windows also has two additional features. My number refers to your rate number, which is remote agent telephonic enrollment. If you don't have a rate number and would like to participate in rate, please reach out to your manager. Accepting calls. When you toggle this button on, you'll be able to receive a rate call. So accepting calls and my number go hand in hand. Action items and lead alerts will navigate you to the notifications page, and messages will allow you to view any messages past or present. From this screen, you can also change your password, edit your account information, and sign out. Similar to what we saw with the iPad drop-down menu, the majority of this information looks the same for Windows. However, default browser and offline mode are two additional buttons that are not available on iPad. Default browser will open your enrollment form in the browser of your choice, whether that is Chrome, Internet Explorer, Firefox, or another browser. Offline mode will show you if you are connected to the internet. We do have offline capabilities as well that we'll get into later on in the presentation. If you need to edit your account information, you'll just need to click on My Account in that drop-down menu, and then make the changes necessary to your account and click Save. Now we're going to spend some time navigating through all the different options on the navigation bar. First up is the home section. On this home screen, you'll notice under my name, it has notifications. Any notifications that you have will appear here and in the upper right-hand corner. Below that, where it says, what would you like to do today? These are your resource quick links or tiles. All of these tiles have been made by managers, and they are very important information or items that you will utilize frequently. For new action items, the icon of a triangle in red means that there is a message you must read and acknowledge. You can get to that message by clicking on View Notification. And you can also go to that upper right-hand drop-down corner and select messages there or action items. Next to my name in the upper right-hand corner, there is a blue circle with a number. That number will indicate how many action items you have. From there, once you click on your action item, you'll be taken to the messages screen. If there is a message that you haven't read that requires acknowledgement, you'll need to click on that message, read through it, and then click the Acknowledge Message button. Your manager has the option to require acknowledgement, and that's typically utilized when information is very important and something they need to make sure that you are reading. Once you've acknowledged that message, it will change to Acknowledged, which will then allow you to carry on. It is important to call out the fact that you cannot start a new meeting if you still have messages to acknowledge. I always recommend as soon as you log in for the day, check your messages, check your alerts, and make sure everything has been addressed before beginning your business. The next section is the leads section. On this screen, you will have new leads up at the top and all leads down below. This is the section where you will manage your book of business. Under new leads, where it has the source, if the lead is coming from Salesforce, that is where you will see the SFDC moniker. You can tap anywhere on a lead to view it, and you can also search leads using that search bar. To add a lead from the screen, you'll click on Add a Lead, which will pop open this new lead section. You can enter in all of the information manually, and you also have the option to scan a driver's license. If you would like to scan a driver's license, you just flip it around to the back, line it up with your camera, and tap your device to scan the image. It will import the data and not take a picture. This does vary state by state as to what will get pulled in by the license. So once you have access to your mobile application, I do recommend taking your own license and practicing with it to see what information will be pulled back in. You'll then finish collecting the lead information, and you also have the option to scan the Medicare card as well. I do recommend filling in as much information here about your lead as possible, because all of this information will carry over to the enrollment application, which just makes that process go a lot quicker as well. Once everything is filled out, you'll click Save to add your new lead. You'll then be redirected to the lead information screen. On this screen, you can easily edit your beneficiary information. And we have quite a few options for meetings here. We define meetings as your interactions with your prospect while using Ascend. Below the name of your lead, you'll see upcoming appointments, past meetings, and then further below, offline enrollments. From this screen, you can also create a scope of appointment or home visit, and you can go straight into Start a Meeting. Further down that same page, you have the option to add in a note for your lead, edit personal details, and have the option to add a related lead. Related leads can be completed applications simultaneously, so that way you don't have to go back out of your meeting, start another meeting with your second beneficiary if they're both sitting right there. And you can complete them in a 2-tab situation. To add a related lead, you'll click Add Related Lead. Select the lead that you have already created for that second prospect, and then it will add it to your first lead, which will link the two together. If you need to edit any prospect information, you can easily do so by clicking Edit. It will pop open that screen that we saw previously when creating a lead, and you'll just make the necessary adjustments and click Save. On that lead information screen, we also have the ability to create a scope of appointment. Ascend has an electronic scope of appointment capability, which can be emailed or texted to your prospect from Ascend. The scope details are filled out automatically from the lead that you have created or that was pulled over from Salesforce, and it will pull in your information as well. Your prospect will confirm the appointment digitally, and you'll immediately see confirmation of the appointment in your mobile application. This scope information is then stored in the Ascend Real-Time Manager, and your managers can retrieve it easily. To create an electronic scope of appointment, you'll navigate to that lead information screen, click on Create a Scope of Appointment, and select Electronic Form. From there, you'll be presented with a list of electronic scope of appointment forms. So you'll need to then select which form you would like to continue on with. After selecting your form, it will pop open that form. You'll select the products you wish to discuss and make sure that all of the fields indicated with an asterisk are filled out, as those are required fields. If you are going to send the invite via text, please make sure that the phone number entered for your prospect is text capable. Once you've filled out all of the required fields, you will click Send Invite, which will then ask you how you would like to send it to the lead. You'll have the option to send it via email and text, just email, just text, or no, which we'll get into later. From your prospect point of view, they can expect an email that looks like the image on the left or a text that looks like the image on the right. Both of those links will open up a form that will look like this. Your prospect will then read through the form, and if they agree to the meeting, they'll tap yes, and if they don't agree, they'll tap no. They will immediately get confirmation of the meeting if they approve it, and you will as well in your mobile application. Once an electronic scope has been approved, under upcoming or scheduled meetings, you will see that pending status change to accepted. If it is still pending, you can easily click on the lead or on the scope itself to open up those scope details. For those scope details, you'll notice that if it has not been accepted, it will say pending still. From the screen, you can resend the invite, approve it if you're in a rate meeting and it's being recorded. Your beneficiary will have to give you verbal consent in order for you to tap Approve Invite. From this screen, you can also delete the scope altogether. We do have the option to capture a scan of a paper scope of appointment. If your prospect doesn't have email or text and is unable to utilize rate, you do have the option to capture a scan of a paper scope of appointment. Similar to what we saw with electronic scope, you'll navigate to that lead information screen, click on Create a Scope of Appointment, and then select Paper Form. You'll then capture a scan of that paper form, select the requested meeting date, and click Done. The next section on the navigation bar in your mobile app is Appointments. In Ascend, we have two types of appointments. Home visits are identified with the house icon, and seminars will display the chart icon. You can view all upcoming and past appointments, and you'll just need to tap on one of the appointments to view the details about that specific appointment. On the home visit information screen, after you've opened up those details, you'll get a glimpse of an overview of all those meeting details. You can easily start a meeting from the screen, go to the lead, add an existing scope, or get directions to that visit. Similar with home visits, seminars have the bulk of the same information up at the top of the screen, but down below, there is a guest list. This guest list will be pre-populated by your managers and pushed to your mobile application. And you can easily verify who did or did not attend a seminar by toggling that did not attend button, which will then change it to attended. The recording section is incredibly helpful as well. When you start a meeting with a prospect, your prospect will have the option to have that meeting recorded. If they opt to have the meeting recorded, at the end of the meeting, when you end it, your recording will temporarily be stored in this section. You can choose to upload the recordings via Wi-Fi or a data plan. You can upload them individually, and you can upload them all at once by clicking Upload All Recordings. There is a limit of 10 recordings that can be on a device at a time. So I always recommend, as soon as that meeting ends, go to your recording section and upload that recording. Once you've hit that 10 limit, you won't be able to record another meeting until that recording limit is cleared. So you'll need to make sure that these recordings are getting uploaded rather quickly, especially during AEP. Once they've been uploaded, they'll turn green and say success, but they will ultimately leave your device and be stored in ARM. While they're sitting on your device, you will not have the availability or the option to play the recording. The resources section is where you guys will also have all of these paper documents that you're used to seeing for evidence of coverage or summary of benefits. All of them will be found here. Resources are useful documents that are stored and assigned by your managers and can be links, documents, or presentation videos. Those tiles that we saw on the home screen will also be found in the resources section, but the tiles have just been deemed very important and want to make sure that you have easy access to those and don't have to go searching. There are 3 root folders where you can click on View Resources to view all the resources within that folder. And you can also search for resources using the search bar. If you find other resources that you utilize frequently but are not a tile on your home screen, you can bookmark those so you have them easily accessible. The last section on the navigation bar is the help section. The screen that will populate will give you all the contact information that you will need to contact the Ascend Help Desk. It will also have access to the user manual and provide information that you will need to have handy when contacting the help desk. I do also want to call out that this screen is for technology issues only. Help desk agents cannot speak to plan benefit information, and they will not be able to walk you through an enrollment. Remote agent telephonic enrollment, which is RATE, is a powerful enrollment tool that is housed within your mobile application. RATE will allow you to enroll your clients by phone in a compliant manner. RATE is now available on both iPad and Windows devices. There are several benefits to utilizing RATE. It will save you money. If you've had an initial face-to-face meeting with your prospect and they're not able to finish the application for some reason at that time, you do have the option to set a secondary appointment, which will then allow you to save money on gas, vehicle wear and tear, and tolls. So you don't have to go back and forth for another time. RATE will also save you time. It shortens the sales cycle which ultimately will allow you to see more clients. Rate also ensures compliant selling. As soon as the rate call comes into your device, the call is instantly and automatically recorded, which will help prevent you from complaints later. So, how does rate work? First, you'll need to make sure that you have a number next to my number in that upper right-hand drop-down menu. You'll provide that number to your prospect. If you don't have a number there but would like to participate, please reach out to your manager and they can help set you up. You cannot receive a rate call if you're in a meeting already. So I do stress the importance of scheduling an appointment time that works for you and your prospect. If you are doing a telephonic enrollment without a face-to-face meeting, you do still need to complete an electronic or paper scope of appointment. This can be done through Ascend's electronic scope feature, a paper scope of appointment, or by calling the ABL line. I do also want to note that unavailable and available do not relate to rate and can be ignored. Once that meeting is set, you will provide that 1-800 phone number to your prospect and then ensure you're ready to accept the call by toggling on that accepting calls button in the drop-down menu. Your prospect will then call into your device. Your device will begin ringing and you'll get a pop-up that says incoming call. If you have a lead created already for the person that is calling in, it will have the lead name and phone number. If a lead is not already created, it will still have that phone number, but will then take you to the create a lead screen after you click answer call. If you had the lead created already, you'll immediately be directed to the lead information screen. You'll notice on the left-hand navigation bar that there is now an additional button that says call. At any point, you can tap that button and end the call with your prospect if needed. From this screen, you can also start a meeting and create a scope. If clicking start a meeting, you'll then be taken to the recording disclaimer. Here, you'll need to read through this with your prospect and have them either agree or not agree. The meeting for rate is already being recorded, so that rate call will already be recorded with you and your prospect. The recording disclaimer that appears here will record the audio that is in the room with your device. Both will continue for a rate call if you agree to this recording disclaimer as well. Once you are in, you will tuck your prospect through the approved telephonic enrollment script that is located in one of two places. They are located as tiles on your home screen. And for Allwell, HealthNet, and Ascension, they're also located in your agent guidelines and your resources. For Wellcare, they are available under the Wellcare rate folder and resources also. For best practices, we recommend printing out a hard copy of that script and having it handy, so that way you don't have to flip back and forth between the script and the enrollment application to remain compliant. Now we're getting to Ascend Quote and Enrollment, which is where you guys will be doing the online application. I do want to call out that you still need to go through the normal CMS compliant presentation before starting the meeting and getting to the application itself.
If a company violates the
getting started,
it should be posted somewhere.
Similarly with what we saw with rate, you will click on the Start a Meeting button on the lead information screen and then select that approved scope of appointment form. You'll then click Start Meeting again on that pop-up, which will take you to the recording disclaimer. Again, you'll need to read through this with your prospect and have them either agree or not agree to the recording. This does record the audio in the room with your device. You'll then be taken to the Let's Get Started screen, where you will verify your prospect name and zip code. If you had related a lead, you'll select that drop-down arrow next to the lead name, and then check the additional lead. So that way, once you hit continue, you'll have 2 tabs so you can complete both applications in one meeting. If there is a zip code that has multiple counties, you will see this "What county do you live in" screen, where you will need to select the appropriate county. If the county was entered on the lead, you will not see the screen and you'll be able to continue on. For agents that also sell Ascension Complete, you will still have this change URL function. On an iPad, you'll have the hyperlink icon in the upper right-hand corner, where you'll click on that and then select the appropriate URL for that enrollment. On Windows, you'll click on the Change URL button, and then from the menu, select the appropriate URL to complete for that enrollment. Getting to our assisted shopping tools, the first one that we have available is Blue Button 2.0. CMS created Blue Button 2.0 last year to expand access to healthcare information and improve the seamless exchange of data in healthcare, which gives the patients more access to their data. Blue Button contains up to 4 years of fee-for-service medical claims and Part D drug claims. It can be used to access previously used doctors, medications, and pharmacies to pull back into that assisted shopping experience. This will lessen the time that you spent or that you will spend manually entering information. Blue Button will also more accurately capture beneficiary information for the shopping experience. Because beneficiaries must use their mymedicare.gov login or create an account, Blue Button should not be used when utilizing rate, since you can't ask a beneficiary for their username and password. So to access Blue Button, you'll click on Connect to mymedicare.gov, or click on No, I prefer to enter my information manually. The next few sections that I will show you will be for utilizing Blue Button, and then we'll get into what happens if you want to enter your information manually or in a rate call where you're not able to utilize Blue Button. So if I click on Connect to mymedicare.gov, you'll receive a pop-up that looks like the left image, letting you know that you are being redirected to a different site. That site is mymedicare.gov, where your prospect will use their existing username and password to log in, or they can create an account at this step also. To create an account on mymedicare.gov, your prospect will need to select that Create Account option at the bottom. Your prospect will then enter in their Medicare number as it appears on the Medicare card and register with the same address that the Social Security Administration or Railroad Retirement Board has on file. They'll create a username and password, and note that email address is not a required field when creating an account. They can then utilize that username and password to log in here. For accessing information from Blue Button, after logging in, your prospect will be presented with all of these permission statements. Your prospect will need to read through them, understand the risks, and select Allow or Deny. If they click Allow, they'll be taken to the screen I will show you next. And if they click Deny, they'll be redirected back to Ascend Quote and Enrollment. After clicking Allow, your prospect will also have the option to to share a separate amount of data. They can decide to share all of their data or share healthcare data, but not personal information. After they click allow, you'll then be redirected back to Ascend Quote and Enrollment and on the My Drug section in that navigation bar at the top. The first shopping tool is the pharmacy tool. Blue button will pull in a list of previously used pharmacies, and you can easily select one to add to the quoting experience or search for a different one manually. To add to the shopping experience, you'll fill in the radio button next to the pharmacy, which will then build the My Pharmacy section down below. You'll then continue on to the next lookup tool. The next tool is the drugs. Blue button will also populate a list of previously prescribed medications. You can click on each one and go through the list to see what your prospect still takes or would like to add to the shopping experience to get quoted for pricing. To add it to the shopping experience from that list, you'll just select the medication, fill out the information about dosage, how much is needed, and how long the prescription lasts, and then click Add to Prescriptions. That will then build the My Prescription section at the bottom, also commonly referred to as Medicine Cabinet. The next shopping tool from Blue button is the doctor lookup. Blue button will also pull in previously used providers into the section. You can easily add a new physician. You can add a physician to the shopping experience by clicking Add, or you can search manually for a new one as well. After adding a doctor to the shopping experience, it will build the My Doctor section down below. You can then continue on. Now I'm going to walk through these features without utilizing Blue button to show you what it will look like doing a manual search. First, I do want to point out that the navigation bar where it says Health Profile, you can skip around to these different sections. If you click on Our Plans in Section 5, it will take you directly to the plans. So if your prospect doesn't want to utilize the shopping tools, you can easily bypass these and go straight to plans. The first thing will ask you if your prospect has a pharmacy that they want covered. Clicking No will take you to the next lookup tool, and clicking Yes will take you to the lookup tool itself. Your prospect will then be asked what pharmacy they use. Here, you can search by pharmacy name, narrow it down by the type of pharmacy they would like to see, or search within a specific mile radius. If searching within a specific mile radius, a list of all the pharmacies available in that area will populate. You can add them to the shopping experience by filling in the radio button. And if there is a cluster on the map and you're not exactly sure where that pharmacy is, you can zoom in, or you can click on the flag that is to the left of the pharmacy name, which will then in turn bounce the corresponding flag on the map, showing you exactly where it's located. Once a pharmacy has been added, it will appear in My Pharmacy down below, and you can then click Continue to go to the next tool. The next tool is the formulary search. Your prospect will be asked if they take any prescription drugs. They can click No to continue to the next lookup tool, or you can click Yes to take you to the lookup tool itself. Here, you'll be able to search the formularies by either typing in the name of the formulary or browsing alphabetically. If you begin typing in the name of the formulary, a list of suggested medications will begin to populate. If you select from that list, you'll be taken directly to the drug details screen. If you decide to browse alphabetically, you'll just click on the letter And it may take a few seconds for that list of medications to populate, depending on how many medications there are for that letter. After finding that medication that you would like to add, you will just click on Add, which will bring up the drug details screen. You'll fill in the dosage, quantity needed, packaging if applicable, and how long the prescription lasts. Once all of that is filled out, you'll click Add to Prescriptions. If a generic alternative is available, you will get a pop-up that asks if you want to choose the generic instead. Clicking OK will add the generic to the shopping experience, and clicking Cancel will add the name brand. Once the medications have been added, it will build the My Prescription section at the bottom of the screen. There is not a limit to how many medications can be added, so you don't have to worry about hitting a cap at any point. Once all the medications that you have been added, you'll click Continue, which will take you to the doctor search. You'll be asked if they have a doctor you want covered. Clicking No will take you to the next lookup tool, and clicking Yes will take you to the provider lookup tool itself. Here, you can enter in your beneficiary's doctor's name and search, or you can do an advanced search, and even still, you can just search within a specific mile radius, similar to pharmacy. I do want to call out that HealthNet providers are not integrated with the tool. So for HealthNet, you will not be able to utilize this search, but within the HealthNet application itself, we will have the provider link for the Find a Provider tool. If performing an advanced search, you will be presented with quite a few options to narrow down that search. You can enter in more details about that doctor in particular, narrow it down by services, coverage, or location. If you search within a specific mile radius, you will see a list of all the providers that are in that area. You can click Add to add them to the My Doctor section at the bottom of the screen, or you can click on More to view more details about that doctor. Clicking on More will bring up the doctor details, where you'll be able to see more information about the provider, the office and location, hours of operation, and plans that are accepted within that zip code. After you've selected the provider and added it to the shopping experience, you'll click Continue, which will take you to the Extra Help or LIS check and Medicaid verification. Here, you'll be able to perform a check for extra financial help and verify any Medicaid status for your prospect. Clicking No will take you to the quotes page, and clicking Yes will take you to the verification tool. If you have clicked Yes, you'll be able to enter in information for your prospect to check extra help eligibility and Medicaid status. In the notes section at the bottom of the screen, the list of the required fields will change based on the state selected for Medicaid state. For any date fields and AQE from this point forward, you'll need to enter in leading zeros if it's a single digit. For January, for example, you'll enter in 01 instead of just 1. And for day, if it's the 5th of the month, you'll enter in 05. After checking status, a screen will return that verifies Medicaid status if you've entered the required fields for that check, and will also let you know what percentage your prospect may be eligible for extra financial help. This is just a check, and your prospect will still need to go through the state process in order to enroll in the extra help program. the quotes page, there are quite a few things on this screen. Here, you'll be able to compare plans, view them all in list format, which is the default screen, send a quote, which relates to our quick quote feature that we will dive deeper into later on in the presentation. And on all the plans, you'll get a good overview of some of the plan benefits. If a provider was selected during the shopping experience, you'll also see whether that provider is in network on this screen, indicated by a green check. Again, for HealthNet products, you will not be able to have in-network providers on the screen, and if one was selected, they will all show out of network. So once you get into the application, make sure that you find a provider using that Find a Provider tool for HealthNet products in particular. From this screen, you can apply now, which will take you directly to the enrollment application, or you can click on View Details to view more details about a specific plan. If you click on View Details, you'll be taken to a screen where you can learn everything about that plan in particular. At the bottom of the screen, there are links to plan documents as well. On the screen also, you can go back to the quotes page, or you can apply from the top or the bottom of the screen. If you want to view all the plans in comparison, you'll click on that Compare tool that is on the quotes page, which will line them all up side by side. From there, you can exit some of the plans if you don't want to compare them by clicking on the X in the upper right-hand corner. Comparison tool is great to see all the features and plan specifics side by side to view the differences and help determine what plan your prospect would like to enroll in. Once your prospect has found that plan and they know that that's the one, you'll tap on Apply Now, which will take you to the enrollment application. The first screen is the Tell Us About Yourself page. All the information that was entered as a lead on your mobile application will be pre-populated here. You'll need to verify or fill in information that wasn't pulled over or wasn't entered on a lead, and then click Next to continue. Throughout the application, at the bottom of the screen, you'll see these two buttons, Save and Send for signature. Save will allow you to keep your progress in an application so you can return to it at a later date. Clicking Send for signature will allow you to send a pre-filled application to your prospect for review and signature. This works very similar to our quick quote function. The next screen is the Where Do You Live screen. Again, the address that you've entered on your lead will carry over here as well. If they have a mailing address that's different from their residence, you will have additional information to fill out. So fill out all the required fields and then click Next to continue. The next section is the Who is your emergency contact. These fields are optional, but as you begin typing, all the fields will become required. To make sure that they are not required, or if it was simply an accident, you can delete all the data, which will again make them unrequired. You will then be asked, who is your primary doctor? If a provider was selected during the shopping experience, they will pre-populate here. If your prospect changes their mind at this point, rather than getting out of the application completely, you'll be able to click on Provider Lookup, which will populate that same provider lookup tool that we saw during the shopping experience. For HealthNet products, however, this link will take you to the HealthNet Find a Provider tool. There, you'll be able to find the provider and then bring back that information to add to the application. The next screen is your insurance information. If the Medicare information was entered on the lead, it will be pre-populated on the screen as well. Here, if it's not pre-populated, you'll just enter in the Medicare number and Part A and Part B effective dates. You'll then tap Verify, which will in real time verify that Medicare insurance information. If for some reason it's not verifying and you know it to be 100% correct, you can click Verify 3 times before being able to continue. That typically happens if a beneficiary is just very new to Medicare and it may not have hit that third-party system yet. The next screen is the What is your current Medicare situation screen. Here, you'll select the election period that best fits your prospect situation and click Next. All of the SEP options are under the third radio button where it says My situation falls under one of the special election period circumstances. If they have an SEP circumstance, you'll just select the appropriate SEP, fill out the date if it's applicable, and then click Next. On the Other Living Situations and Health Services screen, you'll have your prospect answer the yes or no questions. If they select yes, some more information may be needed. Down that page, you also have document preferences. Your prospect will have the option to receive information in a language other than English or in an accessible format as well. Next, you'll see the Information Authorization screen. You'll need to read through all of the disclosures with your prospect and then have them type in their name as signature of applicant. In the relationship section, they'll fill in one of those radio buttons. They'll fill in the first one if they are the person listed on the enrollment form. And the second one will be utilized for authorized representatives. For authorized representatives, there will be additional information for them to fill out about that authorized rep. You'll then be taken to the plan payment screen where your prospect will have multiple options for plan payment. Based on the selection, there may be additional fields to fill out, so make sure that those are filled out as well. You'll also need to review all the payment overviews with your prospect before continuing on. Finally, you'll get to the review page or application summary. Here, you'll review everything with your prospect for accuracy. And if something needs changed, you can easily click Edit to take you back to that section to change the information. Once everything is confirmed for accuracy, you'll click Apply Now to submit the enrollment application. For Wellcare plans, your confirmation page will look similar to this. Here, you will have the option to email the confirmation number to your prospect or print the application summary and confirmation number. You'll want to also make sure that you provide that confirmation number to them if they don't receive it via email or by printing that application summary. For All Well and Health Net plans, you'll have the same options on the left-hand side. But on the right-hand side, you will also have value-based enrollment. So this is where the value-based enrollment program will start, and you'll need to select the language for which you would like the call to take place. I do want to point out that while Wellcare plans do not have the VBE options on the confirmation pages at the moment, you will still have your Revel links as tiles on your home screen of your mobile application. So this next section, diving into value-based enrollments more for All Well and Health Net products, may not be relevant to you now, but I do recommend that you'll absorb some of this information as it will be coming in the future. So what is VBE? Value-based enrollment is a quick and easy process that we utilize to gather health-related information from your prospect at the time of sale. After you've completed an enrollment application in Ascend, you'll have two options to initiate a VBE call. Once the call is connected, your job is finished. The value-based enrollment rep or wellness advocate will complete the health risk assessment and or help schedule an annual wellness visit with a primary care physician. There are a few important steps for you to be successful when utilizing VBE. Everyone benefits from initiating VBE. The health plan will receive health risk assessment data in order to help ensure that your prospect gets the care that they need, which will in turn help reduce costs for the health plan. If an annual wellness visit is scheduled, healthcare providers can then help identify and prevent illnesses and also reach out to other resources if necessary. That also focus on preventive care will help reduce costs. Value-based enrollment also reduces the cost and difficulty of contacting members at a later date to gather that health risk assessment information. It also reduces complaints to CMS. You, as the agent, will earn the trust of your new member since they will recognize that you are helping them get the most out of their plan right away. It will also increase their stickiness rate. We have found that enrollees who interact with the health plan right away are more likely to stay enrolled with that plan and less likely to disenroll, which means you'll be able to keep your commission from that enrollment. Your beneficiary will also benefit with that focus on health risk assessment and getting that data early. They will also be able to schedule those annual wellness visits or appointments that are necessary to help prevent illness, identify other illnesses, and schedule additional services as necessary. To initiate the VBE process, there are a few options. This always occurs after you've completed an enrollment application. You'll need to leave the beneficiary when they're on the VBE call. And remember that the health information they share with us on that call will not affect their application being approved by CMS. For this call, you should not be there to help or coach your prospect in any way through the questionnaire. You'll prepare by completing all of your sales process steps before initiating VBE, such as making sure to give them the enrollment confirmation number found on that confirmation page. Let them know when they can expect their membership cards and provide your contact information should they have any questions. Explain the VBE process and what they can expect. If they agree to participate in VBE, let them know that you'll excuse yourself once that call comes in. And then explain the VBE process to them. You'll first invite your new member to participate in VBE. Remind them they are not required to do this, but it will help benefit them and their health. Your new member may not know why completing the HRA or setting up an annual wellness visit is beneficial. So we have provided some introductory verbiage to cater to you and allow you to create sort of an elevator pitch that will best suit your needs to explain the VBE process. This is just a template and can be changed to however will suit you. For All Well and Health Net plans, you have this VBE screen on the confirmation page, which allows for 3 different options. Connect Me Now connects an enrollee on the spot. This is the option where you will need to leave the meeting location as these begin. Schedule a call back will allow you to assist in setting up a call at a later date or time of your prospect's choosing. The decline option will simply just decline value-based enrollment entirely, and no action is taken. For Connect Me Now, if that option is selected, you'll get a pop-up box that says Connect Me Now with the phone number from the enrollment pre-populated. Verify that this number is in fact the number they would like to be connected with, and then click Call to prompt a wellness advocate to call the beneficiary. For the Connect Me Now process, the call center system is actually placing the call. Your prospect or beneficiary will be on hold briefly before the wellness advocate comes on, and they will hear the following greeting. Thank you for selecting plan name to meet your healthcare needs. Please stay on the line to be connected with a representative who will initiate your healthcare assessment. All calls are recorded for quality assurance purposes. Once that call connects, you'll need to excuse yourself and leave the vicinity. If your beneficiary becomes impatient with the hold time, they can always schedule a VBE callback at a later date. At the very beginning of AEP and at the very end, we do have a very high call volume and try to keep that wait time down as much as possible. To schedule a callback, you'll select that second option on the confirmation page screen, which will pop open a box that says schedule a callback. Here, the phone number will again be pre-populated, so double check that that is in fact the phone number in which they would like the call to take place. You'll select the date and time for the callback and fill out the time zone. Please make sure that the time zone is in fact the time zone that your beneficiary lives in, as the call center may be in a different zone. If we are unable to make contact with your prospect at the scheduled callback time, we will try to reach them 3 more times, because completion of the VBE process is of course the goal. We want to help get those prospects the health needs and services that they are needing. If your prospect opts to not participate in VBE, you'll just select the decline option and be presented with a pop-up just verifying that you are in fact ready to decline the opportunity to get transitioned onto the plan. To decline, you'll click OK. And if your beneficiary changes their mind at that point, you can click Cancel and select the Connect Me Now or Schedule a Callback option. Once you have initiated VBE for all Well and Health Net products, or if you're a Wellcare product and you've gotten to that confirmation page, you'll then be able to end the meeting with your beneficiary. In the upper right-hand corner of your mobile application, you'll see the End Meeting symbol. You'll click on that button, which will open up the How did the meeting go section. Here, you'll select the disposition, which will open up a drop-down menu of dispositions. So you will need to select the most appropriate meeting disposition. Once it's been selected, you'll tap Finish, which will end the meeting and the recording. We're going to spend some more time diving into some of those items that we glossed over at the beginning. The first one is quick quotes. On the home screen of your mobile application, you will also have a tile that is called Quick Quote. That tile will direct you to a QE and allow you to go straight to the plans after entering a zip code. You'll then find the plan that you would like. Click Send Quote at the top of the quotes page and fill out the required fields for the Send Quote pop-up on the right image. You do have the option to send multiple plans for comparison at your prospect's leisure. Or if your prospect knows exactly what plan they want to enroll in, you can click on Application Only. The verification code for this process can be sent via email or text. So just make sure that they have one of those two options available. If sending via text, again, ensure that that phone number is a text-capable phone. Once the required fields are filled out, you'll click Send to send it off to your prospect. Throughout the application process on the enrollment form, we saw that Send Completed Application for Signature at the bottom of the screen. To begin that process, you'll find the plan in which they would like to enroll. Click Apply Now. Fill out as much prospect information as you can. And then at the bottom of the screen, click Send for Signature. Clicking Send for Signature will send all the information entered on all pages, meaning if you get all the way to the review page and go back to the Tell Us About Yourself page, all the information captured in between will still send to your prospect. After you click on Send for Signature, you'll then complete the required fields and click Send. This screen looks very similar to what we saw with Quick Quotes, and the process is also pretty similar. Make sure that email address and phone number are entered if you're going to send the text verification code. You can also send the verification code via email, and your prospect will receive at least one email, no matter which option is checked. After you filled out the required fields, click Send, and you'll immediately receive verification that the code was sent, and you'll have the verification code on the screen as well. From the prospect point of view, everyone will receive an email that looks like email number 1. This email will actually open up AQE, so they can then enter in that verification code and continue with the application. If they also wanted to receive the verification code via email, they'll receive a secondary email moments later with their verification code separate. After clicking on that Click to Resume button in the first email, your prospect will be directed to AQE, where they will then enter in the verification code that they received via email or text and click Submit. They will then review all of the information that you have entered for them and make any changes if necessary. They'll get to that review page or application summary, review all the information there, same as you would when assisting them, and click Apply once they're ready. On the confirmation page, depending on if it's a Wellcare product, they will see the screen that we saw earlier for the Wellcare confirmation page. If it's an Allwell or HealthNet product, they will also have the option to initiate VBE from this screen. If you send an application for signature, you will be credited with that enrollment. And for Allwell and HealthNet, if they initiate VBE, you will also be credited with that VBE initiation. Also on your home screen, we will have a tile for Agent Portal. Agent Portal lives in AQE and will open up to this screen where you can track your enrollments. You will receive updated statuses for each enrollment in your Agent Portal, making it easy to track where they are in the approval process. On this screen, you can also scroll that bar over to the right and print that application summary that we saw earlier from the confirmation page. You're also able to navigate to value-based enrollments to track the status of initiated VBEs as well. On the Quick Quotes tab, you will be able to view information regarding Quick Quotes that have been sent, and you can resend Quick Quotes from there too. Up at the top with the 3 blue arrows, we're going to go to the agent credit URL next, and then saved applications. For the agent credit URL, each agent will be assigned a specific URL to you. It's created upon your first login, and it's attached to your writing numbers, so you'll be credited with that sale if someone submits an enrollment through the application. Your agent credit URL can be retrieved by clicking on that agent portal tile on your home screen of the mobile application, and then clicking on agent credit URL. From there, you'll be able to copy that URL and distribute how you see fit. For saved applications, throughout the application process on the enrollment form, we saw that save button at the bottom of the screen. By clicking that save button, your application will be saved and will go to the saved applications or applications in progress section. Here you can view the saved enrollments, when it was last edited, and you can edit from here or delete it altogether. I do want to note that saved applications only last for 7 days. So after 7 days, that data will be erased completely and you'll have to start over. So make sure that these are getting completed in a timely manner. To complete a saved application, in your mobile app, you'll select your lead, click Start a Meeting, verify that the zip code and lead name is accurate, navigate to Saved Applications up at the top, locate your lead's name, and click Edit. From there, you'll finish the application and send it off for processing. An additional feature that is built into the mobile application is offline enrollments. This will come in extremely handy in rural areas where internet access may not always be the best. To begin an offline enrollment, you'll note that you're offline by the indicator that says offline under your name. On this screen, you can either navigate to the lead screen to select a lead, or select from the new lead section that is further down the page. You'll go to the lead information screen for that prospect and click Start a Meeting. You'll also need to make sure that your scope of appointment is approved before you start the meeting, and make sure that you have conducted that CMS approved sales pitch as well. After clicking Start a Meeting, you'll select the scope of appointment that has been approved, and then click Start Meeting. You'll see that familiar recording disclaimer where you will need to read it to the beneficiary and have them either agree or disagree to recording the meeting. You'll then verify that the name is correct and verify that zip code as well before clicking Continue. You'll then be told to select an enrollment form for your prospect. You'll click on the appropriate form, which will open it up for you to fill out. For offline applications, since it's not connected to internet, you will not be able to utilize any of the shopping tools or verification tools, or initiate value-based enrollment. So you'll need to fill out all of the required fields as indicated with an asterisk on the screen. And once you have reviewed, click Submit. Once the form has been submitted, you'll see at the bottom of the screen that it will say Form Successfully Saved. You'll then end the meeting and select the most appropriate disposition for that meeting. You'll then click Finish once you're done. While you are not connected to the internet, your device will say that your enrollment is pending. This can be found on the lead information screen under offline enrollments. I always recommend that as soon as you're able to get internet access again, you go back into your mobile application and make sure that that app has uploaded. This is especially critically important nearing the end of AEP to make sure that any offline applications you have are in fact submitted so they can be processed on time for your prospect. Your offline enrollment status will be updated once it has been submitted. The timestamp of your enrollment application will reflect the time that you connect to the internet, which is why I stress the importance of getting connected to the internet again and verifying that that has been submitted as soon as you're able. To confirm the lead status, once the offline application has been submitted, you'll return to the lead section of your mobile app. On the lead information screen, you'll verify that the lead status has been updated to represent that the application was submitted. At the very beginning of the presentation, we discussed briefly Sandbox mode. Sandbox mode is our test environment where you can test nearly everything that you've seen here today. You will not be able to test rate or value-based enrollment, however. On that initial login screen of your mobile application, you'll toggle on the Sandbox mode button. That will present you with a pop-up that lets you know that you are entering Sandbox mode. While Sandbox mode is enabled, you will not be able to use the application. Oh, you will be able to use the application for testing or training purposes. Any data that is created, modified, or deleted during Sandbox mode will not be saved. You will not be able to recover any information entered while in Sandbox mode. Each time you exit Sandbox mode, it resets itself. Once you've clicked OK, you can then log in. Once logged in, you'll notice that the home screen will look slightly different than what you're used to. Up at the top in the yellow box with red lettering, it notifies you that a send is in Sandbox mode. Changes made will not be saved. Here, we have also pre-populated with lead alerts, messages, and appointments. You'll be able to practice walking through everything, creating leads, and walking through the entire AQE application and submitting it to see exactly how that entire process works. Once this goes live on 7/1, I recommend getting into Sandbox mode and playing around with it as much as possible to help yourselves become familiar with the process. In AQE, you'll also notice that you're in Sandbox mode. At the top of the screen, it will have a similar box in yellow with red lettering that tells you you're in Sandbox mode. Always triple check that you haven't accidentally exited Sandbox mode somehow before submitting the application. Once you've conducted all your business for the day and you're ready to log out of your mobile app, you'll click on the drop-down arrow in the upper right-hand corner and click Sign Out. That is the end of the presentation. Thank you everyone for attending the training today, and best of luck.